Welcome to my second part of my journey of finding post-traumatic growth. If you missed the first part, please hit the link below. Now, back to my story. Finding growth to overcome any trial takes time and work, and it can feel impossible at times. Growth requires deliberate, positive actions. True post-traumatic growth is actually moving to a higher level of growth after the trauma. As a therapist for more than 20 years, I've heard some amazing stories of people through post-traumatic growth. For example, cancer survivors reporting, it's improved their life. People that have gone through divorces now saying their life is better after the divorce. And it's just amazing to hear these different stories. One key to post-traumatic growth is finding what Dr. Tedeschi calls an expert companion. Not always a professional, but more of a friend or guide that will stick with you through your struggle. Now, often we experience a trial in life and society might tell you kind of like to suck it up. It will get better with time. Now, why do some people give you that cold shoulder when you're at your lowest point? I think some just don't know what to say or do. Although not all trials you face will necessitate seeing a doctor or therapist, I do believe there are times when you will need one or both. Finding helpful others, otherwise known as this expert companion, will take a little bit of effort, and I encourage you not to give up. Dr. Tedeschi wrote, "In using the term, we don't mean to imply that this companion has to be a professional or have received any special training. Rather, this companion is an expert in providing a sense of compassion and understanding for you in the aftermath after the traumatic experiences." So the 6 months following my death of my brother were very difficult. As a therapist, I soon realized I needed to talk to someone about this problem. I was experiencing those internal symptoms, including sorrow, grief, irritability, sleeplessness, and being overwhelmed at work. I knew I needed to address these underlying issues of grief and pain so that I could address my own post-traumatic growth. My experience with therapy was not easy, but the results of my life have been worth it. There are many modalities to help with trauma and even more therapists who practice them. I used eye movement desensitization and reprocessing, or EMDR, to help me, and it was a game changer for me. Now, EMDR is very similar to the traditional therapy where you sit with a counselor and talk about challenges that are impacting your life in a negative way. What makes EMDR a little different is that there's a provider that will help you access traumatic memories and process them to reduce the intensity of that remembrance. In my experience, the memories and the stress improved in some dramatic ways. Unlike the traditional talk therapy, during EMDR, you're asked to talk while simultaneously focusing in on some external stimulus. Most common of these external stimuli include a direct lateral eye movement back and forth, or listening to some audio beeps in a headset, or holding some devices that vibrate or tap in your hands. Now, I participated in sessions that included each of these different approaches at different times, and I found them very calming and very helpful. Now, you may be thinking, this is strange, that's a strange approach, but repeated studies have shown that healing and recovery can be very rapid when using these type of techniques. More than 30 positive controlled outcome studies have been done on EMDR. Some of the studies show that 84 to 90% of the single trauma victims no longer have this post-traumatic stress disorder after only 3 90-minute sessions. Another study founded by an HMO, Kaiser Permanente, found that 100% of the single trauma victims and 77% of the multiple trauma victims no longer were diagnosed with PTSD after only 6 50-minute sessions. Another study found that 77% of the combat veterans were free from PTSD in 12 sessions. So over 100,000 clinicians throughout the world use this type of therapy, and millions of people have been treated successfully over the past 25 years. There's been so much research on EMDR therapy that it is now recognized as an effective form of treatment for trauma and other disturbing experiences by organizations such as the American Psychiatric Association, the World Health Organization, Department of Defense. So after more than a year of EMDR therapy for myself, I came to the realization that through my life trials were not welcomed. I was able to find relief and even personal growth through these experiences. I also felt a greater purpose and a personal mission to help others. I'm happy to report that I found post-traumatic growth after these experiences, but it did not happen overnight. I experienced some breakthroughs in post-traumatic growth. Now, these are not just theories that I read about or practice with my clients. I personally use these methods to survive, and they have become part of my lived experience. I hope some of the solutions I have found to my personal challenges can help you transform your adversity and become what I call a trial tapper. I know I'm not unique in having trials and traumas in life. I experienced normal reactions to some abnormal events. My goal is to share my story and attempt to help others who might struggle with their own trials. I don't have all the answers, and I will often tell people, I don't know why you had to go through this trial. You may experience some common trials in life or some very horrific trials that no one should have faced. There may be no answer as to why. I hope that you will eventually find peace, although it may not happen for many years to come. What I can tell you is that your successes in overcoming past trials have prepared you for these weightier challenges that you may face in the future, and you will need to rely on your past to help you through them. The trauma, pain, and sorrow from your trial will be undeniable and personal to you. Know that you are not alone in this world as you experience trials and traumas. Everyone will go through pain in their own individual life and struggles in areas such as financial, health, employment, relationships, abuse, addictions, etc. Your experience in overcoming the adversities of your past have prepared you for the trials you face today. Everyone I work with can identify a trial from their past that they have successfully overcome. As they look back on those challenges, often they will identify how those experiences have helped them now. One question I have is, as you look back on your life, what challenges did you experience as a child that have helped you now? What challenges can help you in adulthood? What have these challenges shaped your ability to tackle these trials you face today? This post-traumatic growth is possible for you. The neat thing about it is that many people report as they go through these positive actions or steps, things get easier. I coined the term the trial action path, or TAPS, to discover the journey of post-trauma pain to growth. From my years of experience, I can tell you that your ability to overcome adversity will increase dramatically if you can absorb these first 5 things. First, post-traumatic growth is possible after any trial or trauma you have faced. Second, despite your trials, you have been able to grow strong enough to do many great things. Third, you have the strength within you to overcome any trial. Fourth, many people suffer with trauma and trials alone longer than needed. Fifth, there are many skilled therapists that can help you with all sorts of trials. Imagine how life could be different if you viewed each trial before you as an opportunity to grow stronger. What opportunities could trials provide you? How could they enable you to help others? So many individuals I've worked with have been able to move past pain and towards growth. That's why I'm so excited to share with you what it means to find post-traumatic growth and to become a trial tapper, so you can get these type of results too in your life. My purpose is to help others use my life experiences and teachings to grow stronger from their own trials. Those who take advantage of therapy and find post-traumatic growth could call themselves trial tappers. What is a trial tapper? It is anyone who wants to find hope, resilience, and post-traumatic growth in the future. If you want to hear more about my story or learn about how to become a trial tapper, then consider watching some of the videos on my YouTube channel, Trial Tappers. In summary, post-traumatic growth is possible after all trials and traumas. It might take time. Yet it is possible, at least one of the 5 domains, you can find some post-traumatic growth, and I invite you to take some positive actions to seek this new level of growth. Join me in taking positive steps towards healing and becoming a trial tapper. As a trial tapper, I tap pain, I find a path, and I grow stronger. If you enjoyed this story, please share it with others. If you want to see a story of how someone overcame another trial, watch this next video.